All right, the problem that I had is my teeth fit sort of like this. They were hitting at the back and the front teeth were not hitting. I could put my teeth together and stick my tongue out at you. Dr. Spencer actually made a module of my mouth, and he sat down with me and we looked at it, and we could see, it was just hitting on the back tooth on each side. That's all it was hitting. And of course, he did some different tests that showed that's the only place it was hitting. And so he just started working with that module, and slicing off little pieces here and there so that it would come together, so that, the front teeth were coming together better. And then he said, well, it's going to take replacing 5 crowns in order to do that. Now, I was probably in for about 4 hours that first day, because he took off the 5 crowns, and he found under each one of them there was decay, so it needed to be done anyway. And I think there were 3 crowns up here, and it was really, a bad situation under those crowns there. He had to do quite a bit of buildup. He did 1 above here and 1 below here. And he put me in some temporary crowns, and I had to wear those for several months, because he said, I want to see if your mouth will stay like this or it will shift back. But immediately with those temporary crowns, I could eat things I couldn't eat before. I could bite things. I wore the crowns for a while, and then I would come in and he would look at them and he would see that it was still where it needed to be. And of course, he did a lot of testing with the little strips that he put in there to see, is it touching where it needs to be touching, and all that. Is my bite correct? And since when my bite didn't change, then we started working on my permanent crowns. I would highly recommend Dr. Spencer, because he listens to your problem. He has the technology to pinpoint your area where the problem is. Then he has the technology to produce the crowns that's going to fit your mouth the way it should.